Which is the best toothpaste?
Very often I get asked what's the best toothpaste to use. So there really is no best toothpaste, whatever works for you, whatever flavor you like. A toothpaste should have three to four things. One, it should have a cleaning component, something that makes you feel fresh. Secondly, some fluoride in it to maintain good um, prophylaxis in your mouth so that you don't get easy cavities. And third, the flavor. Fourth component would be if you need some medication in that toothpaste to focus on the cause that you're using it for. So most patients who do not have sensitivity, do not have bleeding gums, can use any regular toothpaste that's there in the market. I just say use a toothpaste. Do not use tooth powders because they are more abrasive, they have larger particle size, and they cause more damage. More important than the toothpaste we use is the way we use it and the quantity that we use it. Remember when we are children, when we are much smaller, or when we are using toothpaste for our children, you have to use a fluoride free toothpaste. That's because our children do not know how to rinse out, spit out. So we don't want them to ingest that. So you have specific toothpaste age appropriate. So till the time the child reaches 8 to 9 years of age, use an age appropriate toothpaste. After 9, when the child is getting into, say, an orthodontic treatment type, along with the toothpaste, I would highly recommend using a mouthwash that is centered towards orthodontic braces. It makes sure that the child does not develop fluorosis during the treatment. Because most orthodontic treatments last for a year to a year and a half. And very often I see that children who use these mouthwashes regularly do not have those weakened structures where the brackets for the appliance was attached. So using a mouthwash along with the toothpaste is important during orthodontic treatment. Then as adults, we develop our own choices, and depending on the taste, on the flavor, go for whatever that suits you. But if you develop sensitive teeth, then I would recommend using a toothpaste for sensitive teeth. If you're having bleeding gums, we have great products in the market which focus on improving the gum health. More than this, what I really emphasize on is the right brushing technique, using the right toothbrush. So I always tell my patients, use whichever toothpaste you want, but use the brush that I want you to use, which is always a small head, soft bristle toothbrush, something that can go right up to the back of your last tooth. Now, very often we use very large brushes for a very small mouth. So use a small head, soft brush, and I would recommend using a battery operated brush. It does a far better job than just a manual toothbrush. Again, in toothpastes, there's a rage amongst young kids today to use whitening toothpaste. Don't make that an everyday thing. You can use a whitening toothpaste once in 10 days, once in 12 days. Do not use it every day because it does abrade the teeth. So use your products. And another thing I've seen with toothpaste is that the oral bacteria get used to a particular toothpaste. So a good idea would be that every 2 or 3 tubes of toothpaste you change to a different brand or a different type so that you're always surprising the oral microbiome. Thank you.